Good morning, Kalispell. I hope everybody is doing fantastic out there. So today's Wellness Wednesday, we are going to let the cat out of the bag. Dr. Gillen and I have been working hard these last several months. You've probably seen the teasers on our Facebook page. We are going to start offering hyperbaric oxygen therapy here at the office. So today I'm going to give everybody just kind of a quick overall rundown of what that is. So hyperbaric oxygen therapy, or HBOT, is a treatment in which a patient breathes in air or a varying amount of oxygen inside a pressurized chamber, and the pressure is 1 atmosphere or above. The healing power of oxygen is not anything new. Hyperbaric therapy dates back, ready for this one, nearly 350 years. So the first reported use is back in 1662. The clinical use of HBOT, or hyperbaric therapy, began in the mid-1800s, and in the 1960s, studies began to show a wide variety of clinical benefits. So that is pretty darn cool. It's been around a long time. Today, there are over 150 different approved conditions internationally, so that's a lot of different things that can be helped out. So traditionally, HBOT's been used for diabetic foot wounds, air gas embolism, carbon monoxide poisoning, smoke inhalation, gas gangrene, thermal burns, decompression sickness, and acute mountain sickness. And today, that list has expanded a lot. It can help with diabetes, low energy, Lyme disease, so for all the Lymies out there, cerebral palsy, head injuries, chronic fatigue, brain injuries, ALS, multiple sclerosis, post-surgical care, anemia, wound care, improved performance for those athletes out there, autism, dementia, and Bell's palsy. That's just to name a few. We are getting this tank installed next Wednesday, so be ready, everybody. Another common question, just if you've been in the office, a lot of people have been asking how safe it is. It is a safe alternative to many medical treatments that are offered to you today. Some people report that there's mild pressure in your ears, like if you're driving up to a high elevation or you're in an airplane. A lot of times just chewing some gum can help alleviate that. And there's some tricks too to help, quote unquote, pop your ears. Pretty cool. Another big question we've been getting is hyperbaric therapy covered by insurance? In the United States, there are certain indications which insurance does cover hyperbaric therapy. This includes gangrene, radiation burns, carbon monoxide poisoning, and decompression sickness. Traditionally, they do not cover these treatments for the conditions that we would be using it for. If you're not sure, you can always call the office and ask. Another big question we've been getting, is it safe for kids? Absolutely. It gets great results in children. In fact, research shows that kids that are suffering brain injuries, learning or developmental delays, autism, and genetic disorders get great results with hyperbaric therapy. Another question, is it safe for the elderly? Absolutely. It's actually great for people in their elder years, and it helps provide boosts into anti-aging, which actually is also a use for it, without boring everybody with that. Newer research on hyperbaric therapy shows that it slows apoptosis, which is cellular death. It helps with diabetic neuropathy, dementia, Alzheimer's, overall energy, and healing ability. So if you guys have any questions or comments, please feel free to drop them right below this video in the comments section, or send them to the office. With how Facebook acts, what we've been noticing, it says we have a slow response time. Not really. It just usually doesn't show us that anybody has commented or anything like that for 6 to 24 hours. So if we're delayed getting back to you, that's generally the case. Have a great day, Kalispell. See ya.